Hello, and welcome to another Health Essentials podcast. I'm John Horton, your host. When you think about getting a massage, a certain image probably comes to mind. You probably see yourself relaxed and lying on a table as a massage therapist uses their magic fingers to work your muscles. But Thai massage, an ancient form of healing rooted in Buddhism, is nothing like that. It's not even close, despite what the name might suggest. So how is Thai massage different? That's what we're going to find out today from DeBorah Hill, a nurse and massage therapist trained in this form of care. She is one of the many experts at Cleveland Clinic who join us weekly to teach us how to maintain our bodies so we can always be at our best. So with that, let's explore the restorative power of Thai massage. Welcome to the podcast, DeBorah. Thanks for stopping by to chat.
Hi, John. Good afternoon. I'm glad to have you by.
Well, before we get into our topic today, which, as I told you, I'm really excited about, I want to spend a moment just talking about you because I found your professional bio just fascinating. For starters, you're a level 2 Reiki practitioner. You also do cupping therapy, relaxation therapy, and trigger point therapy, as well as Thai massage. That's just some really cool stuff and just a pretty wide-ranging wellness approach.
Well, yes, it is, John. And I think I could tell you, I think my journey actually began on a massage table about maybe 15 or 20 years ago. My background originally coming from nursing, I found that by that time I had inherited a lot of aches and pains and really a lot of stress that came along with the nursing profession. And it was really only after a couple sessions of laying there, I realized, I said, yeah, I think I could kind of do this myself. And so that's what I did. I transitioned from nursing, bedside care, allopathic medicine, where people arrive to us who are often sick. I want to say, though, I worked in a variety of different areas in nursing as well. So I became very acquainted with the body when the body became sick, or when the body went through recovery, when the body went through rehabilitation. And it was during those moments on the table, I said, well, if I can do this, I can actually work with a population of people in the preventive arenas, in wellness, and for clients who are relatively healthy and they would like to stay that way. Clients who also are well-informed about what they would like to have in terms of their own health and wellness experience.
Well, we're going to hit one of those ways that people can kind of stay healthy today by talking about Thai massage. And I guess to get us started, can you just kind of walk us through what exactly Thai massage is?
Well, Thai massage, just briefly, actually has a very long and ancient lineage. And there's something that I could touch base on it a little bit, but I really want to talk about the modern expressions and the modern practice of Thai massage now that it's really kind of spread around the world. And from my own teachers and from my own lineage, this is what I was taught, and that this is what I would like to share with you. That number one, what we would call Thai massage is actually energy medicine. We are actually manipulating and using your own inherent energy, manipulating them through the sin lines through body work. Secondly, it is a dynamic practice as it does involve yoga asanas. And whereas the client is actually more of a passive participant in this whole regard, and which persons such as myself would be exerting the external pressure needed to put you in some of these beneficial postures.
So you're kind of twisting somebody around a little bit, or
Yes.
kind of having their limbs stretch.
Yes, then they're being stretched, and actually it's within a sequence. Actually, it is quite sequential. And then I think the third aspect of it is that there is a mindfulness component, because as we're working with the body, there is an area where our conscious mind began to descend as we relax, and our subconscious mind began to come up. And at some point, we want to have some kind of a balance. And so that's where we have that mindfulness component that gets built in to the practice, not only just for the client. It's something that I encourage them to do, but it also reinforces my own practice, my own intention as I'm applying this practice with my particular clients.
So as you're working with somebody to kind of guide their body through these stretches or actually like into these sort of poses, I mean, are you just doing it with your hands? Or I read in one thing where you could use the person doing the massage could use their hands, elbows, forearms, feet. I mean, this is all part of it?
Yes. Oh, yes. In the traditional method, and we were talking about modern time, we have traditional method, which is done on the mat on the floor. And then we have more modern interpretations where we're doing it on the table. My preferred method is on the mat, and I think it's more beneficial for me and the client. Traditionally, it's done on a mat on the floor. And what that does for the client is that it induces a deep sense of relaxation because you actually feel like you're on a bed.
Yeah.
You're not on a table. There's no sense of balance issues being triggered. You really feel like you're falling asleep. It also is beneficial for the practitioner because I'm closer to you. And I get to use leverage and gravity as my tools to help execute some of those movements. So very little of my own body energy is used. So when you're on the table on the floor and I'm up over you, I really get to use a lot of leverage as my friend. Secondly, we start with the feet and we work our way to the head traditionally.
Okay, so up the body, you just go.
Up the body, and we're working the sin lines and all of the pressures in the feet, up the legs, moving them through the central channel and out through the rest of the limbs of the body. And we begin with the feet and we work our way to the head. And this actually is very practical because when this form of massage was developed, everyone walked everywhere. Everyone did agricultural work. Everyone worked with animals and things of that nature. So working with the feet relieves the pain and the pressure as you moved and worked up the body. And so during these practices, you're placing them through the poses in a very sequential manner. And that's where the benefit comes from. It's just like what they call lazy man's yoga.
Yeah. So starting at your feet and as you're working up, is that just because that's the area that's I say most sore, or is there some sort of benefit you get by starting there and kind of rolling up? I feel like you're almost like taking toothpaste out of a tube there.
Yes, that actually is exactly it. And I want to point out there is a difference between what Western clients expect versus how this is performed. Starting with the luxurious foot massage is the most easiest way to relax the rest of the body. Versus when I start with the head, I can relax the head and the neck, but it takes a while for that to get to the rest of the body. By the time I get to the head, the body is like jelly because I'm working through all these points, through the sin lines, all the poses in a very sequential and practical way through your body.
And I take it through these Zen lines that you're talking about. Like as you're working on the body, your brain is getting messages that, hey, we're relaxing. This is a very chill experience. And so your mind probably starts to shut down throughout that process.
That is something that I observed in my own experience, but more importantly among my own clients. The rate of respiration changes. It becomes more deeper, more purposeful. More clients, teaching clients how to do belly breathing, diaphragmatic or pranic type of breathing to open up the lung spaces, which of course massages the vagus nerve, which induces relaxation through the parasympathetic nervous system. So all of these things are very integrated to the body. And that's why Thai massage is like my favorite to give. It addresses all of those very vital areas in the body in a very passive way for the client, but also in a very energetic and beneficial way for the practitioner.
Now you said a lot of it is stretching. And I think, like I said, when we all think of a massage, you think more of that kind of like rubbing and kneading sort of thing in muscles to kind of soothe them or I guess loosen them up.
Mhm.
What are you specifically doing then during a Thai massage? Are you just maybe stretching somebody's leg or their arms or as opposed to kneading at it?
Well, if we start with the feet, we start first with the feet and with the ankles. And so when we're stretching, we're actually stretching the bottom plantar of the feet and we're stretching all of the ligaments around the ankles. All right. This really helps with ankle stability, helps to prevent ankle rollout if you're unstable. This also helps with balance. And so moving then from the leg, we start with a nice pull and stretch. Pull that leg out from the hip. And then we bend from the knee. And then we bring the knee up to the chest. So we do these stretching linear motions, and then we do the angular motions to place the person in a posture. So ideally, if the client is relaxed, it becomes a nice pull, push, roll around, rolling through the hip socket. And it's just kind of like jelly, as I am just using leverage, as I'm just pulling and then coming back for that slow push. And then as I do that for myself, that actually feels good for my back. Oh, yeah.
I'm getting relaxed just hearing you talk about it. So now the person having this done, are you laying face up or face down, or do you kind of alternate and kind of get moved around?
That's actually a good question. Thai massage also offers three or four postures, which adds to this dynamism. You can do it first laying face up, or we call supine. Anyone who follows yoga, you can believe that's the savasana pose. That's the beginning, the corpse pose we start off with. You can also start someone face down or prone. You may also start someone sitting up. And I also like to do that for most of my clients were Western because it's always head, neck, and shoulders. So I can do the head, neck, and shoulders for them. And then there's sideline. And a very active and vigorous Thai massage for my more active clients will start face up, sideline each side, and pull you to sitting position at the end. So typically you'll go to 2 to 3 positions as you're doing the postures.
Now, how you said that as the person doing it, they use a variety of things: their hands, elbows, forearms, and even their feet. Like, how does the massage therapist use their feet to kind of help give a Thai massage?
Well, you would do that by standing up. Again, I refer back to the leverage and the gravity. If I'm sitting down next to my client, I have a little bit more, but the more I stand up, I have a lot more. I actually have a lot more of my body weight. And so when we're doing Thai massage with the feet and we're pressing down on fleshy areas, we're just stepping in and just applying our weight. And so we use our feet, we do use our elbows, we use a variety of different parts of our bodies as tools to help us execute some of those movements, which is safe for the client and it's actually kind of safe for us. So we do use a variety of things. We use little things like a Thai stick,
Okay.
and we'll do things like a little star.
Okay. To kind of rub things out a little bit or apply
Yes,
some big
yes,
pressure, some tools.
yes. This applies a lot more pressure than your finger, and you're working into a tight
Oh,
spot.
I've used stuff like that on calves,
Yeah,
and those are it is wow when
yes,
you go over
yes,
some tight
yes.
muscles with something like that.
Oh, absolutely. Absolutely. So, yeah, absolutely. We do use our elbows, we use our feet, we use other parts of our bodies as tools as well.
So it's like walking on somebody's back, like an example of like a form of Thai massage.
Oh, yes, yes, it is. And I want to share too, it does share similarities to other Eastern based type of massage. So I want you to know this is quite common in the Eastern part of health and wellness. And that is often done. Um, Typically when I do it, it's done with a certain pattern along the back. I will tell you, I assess my clients very carefully before I do any walking on their back. And these are typically my clients I've had for a while. We have been working for some very specific goals. And then at this point, I always want to caution people, if you know you have really bad back issues, no one really should be walking on your back. You should let that practitioner know so that you can get the most safest and most beneficial type of session.
Yeah, duly noted on that. Here, I'm glad to hear that,
Yeah.
though. Apparently, I've been getting Thai massage for a long time because my wife had been walking on my back for 30 plus years now, and I just didn't know what to call it. So now I've got an official name.
Yes.
So what the one other thing when we're talking about the actual experience as you're having this done, I
Yes.
read where one of these sessions can last up to 90 minutes.
Yes.
Wow, that just has got to be exhausting. I mean, you got to feel great when it's done, but you've got to feel like just everything in your body was worked.
Yes, and that is actually true. I do feel that is part of the benefit with Thai massage for the practitioner, is that we also adopt complementary poses to what the ones we're placed into ones that we place our clients into. And so we are able to sit, we're able to stand, we're able to move, we're able to stretch as we move around the body. We use the client's body as a counterweight for stretch. For example, if I'm coming back, that's the stretches my back out really, really nice. I don't have to use my energy to do that. I don't. And so I'm using the client as just a counterweight, like a wheelbarrow, like the legs of a wheelbarrow. I can lift and move the client around. Breath work is also important. Being able to manage your breath, synchronizing with the client, or being asynchronous with the client. A lot of these practices I picked up from yoga, from Reiki, from my other practices that I've done personally that help fortify me to be able to do this type of massage for 90 minutes. So yes, I feel pretty good when I'm done with one, but not after
Yeah.
three.
Well, now I feel like we've talked a lot kind of about the physical aspect of it and how you're moving that
Mhm,
body around and muscles and you're stretching ligaments and all this stuff.
mhm.
I want to spend a few moments here kind of talking about the spiritual component of Thai massage and kind of this connection to Buddhism. And you had mentioned this whole thing about moving internal energy around the body, which is just one of those kind of interesting things when you hear about and it just I want to know more.
All right. All right. I'd be happy to share with you what was shared with me. Let's start off with the idea of Buddhism because it is deeply rooted not only within Buddhism, but also within Ayurvedic medicine and also traditional Chinese medicine. And so a little bit brief history. When we learn Thai massage, we know that the father of Thai massage is traced to the physician of the Buddha, Dr. Shivaka Kumurabaka. And so all of us who learn this type of massage trace our lineage back to the doctor. And so as Buddhism spread from India through China, through Southeast Asia, there actually was a very cohesive effect with knowledge, with health, with language. And these things do tend to happen, great shifts in human history. And so there was a focus on health from the beginning, on using energy, on using postures from the Ayurvedic medicine. And so that is where it is derived from. And so, of course, it takes thousands of years for these things to coalesce. But what we have now is a vital modern interpretation, kind of like of what the Thai massage is for most people.
So so this energy, like, well, is it a relaxing sort of energy that you get? Is it a vibrant energy where you get done and you're feeling very like you want to go out and do something, or is it a little bit of both?
It is a little bit of both. And from my experience with most of my clients, it depends on how they feel when they come in. Most clients who come in tired, who feel fatigued, actually will have feeling with a lot more energy. And some of my clients who feel overworked will come in and they have a lot more energy and a lot less pain than when they live. The sin lines have been conceptualized from Ayurvedic medicine, and that there are 10 essential ones that connect to essential points in our body, and they're called murmur points. And we do either acupressure or we do some of the yoga poses to move that energy around. And this energy is already in our body. I'm not giving you energy. I'm not taking energy from you. There are 10 sips in, but there are 4 that we typically do in a Thai massage. One is the Shumana, which is the sin line that goes straight to central channel. There is the Ingala and the Pinkatha and the Ingala, which is both the right and the left side, because in Thai massage, you start on the left side for the woman, the right side for the male. The male is masculine, the left is female. And then you have Kalathari, which is another central type of sin line. In most postures, most things that happen in a Thai massage affects all of these, not once, not twice, but often 3 times. We're working through the sin lines to move through blockages and repair breakages as we conceptualize them along the sin line. And it is the Thai version of Chinese meridians, but they're not the same. The same.
Okay. So it sounds like as you do this, as you go through the massage, you start, like you said,
Yes.
spreading this energy around and just kind of
Yes.
sprinkling it all over the body. So you kind of have these good vibes are everywhere.
Yes. Yes.
Well, there are just so many unique elements to Thai massage. And this, I'm just really blown away by everything going on here. But obviously you're not just doing this just for the experience. There's usually some real benefits to it. So why would somebody consider trying this? What are they going to get out of it?
I would say for anyone who is already receiving a massage, a table massage, I would strongly encourage you to come out and receive a Thai massage for the 3-dimensional full body benefits that you'll receive in just one session. And I want to say that because we are addressing a lot of these different issues all at the same time. And most of these clients will find that they feel better all over and not just those areas they want addressed when they come for a typical massage. Clients who are active, runners, people who actually runners, I would say definitely weekend warriors. I would say people who do high intensity training, those type of people who are very active actually needs to have the nervous system sometimes reset so that their bodies can move a lot more ease and a lot more grace. It also, as we're going through the range of motions and the stretching and the pulling, I don't want to pulling so much, but we're going through the stretching, we're lengthening those muscle fibers. And we're reducing the pain right where it starts. We reduce the dysfunction right where it starts, in the joints and in the muscles. And I would say that it is really a good overall practice for someone who just wants to relax and let someone else kind of apply that type of pressure and energy that you really can't get anywhere else. It's really different from being on the table.
Now, when you're talking with the flexibility, it seems like that's a huge issue for a lot of people. Just, people are just stiff. I mean, so many of us spend our days sitting at a desk doing things. So I know range of motion and flexibility are huge issues. And it sounds like this sort of session really kind of loosens those muscles up and, kind of stretches them out.
That is true. And I would say, and the reason for that is the focus on the feet and the legs. Starting with the feet and the legs can have a tremendous and a beneficial impact for the low back and for the glutes. There is a lot recent talk of pelvic floor. There's a lot of talk of gluteal weakness and gluteal instability. That is why there's a lot of that emphasis is on the legs, because as we're working up those muscles, we are able, when we're doing that deep range of motion, we are really affecting deep-seated tendons and ligaments within the hip capsule and along the SI joint. As we do multiple range of motion, multiple twists, we put twists in there. We do a lot of figure 4s. We do things like hip opening.
Hips are big. I know everybody's hips are always, they're so tight and so problematic.
Yes. We do a lot of those, and it's best done by manipulating the legs. Is there
a lot of focus on back pain too? Because I know that is one of the most common complaints that people have.
Yes, there is also a significant focus on back pain, depending on the position that you're in. The best position to get to your back, obviously, is when you're prone and also when you're seated, because then you can actually go through seated twists, spinal twists, to move those muscles around that connect to the low back. The low back, definitely, you can use feet, but like as I mentioned before, you really have to do a good intake. But there is a lot of palmar compression. There is a lot of elbow compression. And then there is a lot of range of motion using the limbs as guidance to move back. So as I'm moving my arm back, I'm actually moving my side waist and my side
Okay.
muscles just by doing this
Yeah.
here. And so that's how you can see how some of those movements are actually beneficial, helping people.
Now, all of that makes sense to me because obviously you're working those
Yeah.
muscles. One thing I found interesting too was that they said it can also help with headaches. Like, how does that come into play?
So the headache part will come in when we get up to the head, because there's a lot of intricate muscles and neurovascular structures that are in the head and neck that can contribute to headaches. When we're getting up to the shoulders, when we get to the head and the neck to relieve the headaches, we're working first to the shoulders, then to the neck, and then to the primary areas around the scalp. And that actually does require a lot more sensitive acupressure points touching to those murmur points that line up and down the neck and down the head. They also come up to the back of the head and they come up to the front. And so when we work these particular areas through acupressure, we can definitely release headaches.
Okay. Now, you had mentioned stress and anxiety, that it could help lower that, which makes total sense
Mhm.
given how relaxing some of the sounds as you're laying there.
Mhm.
One of the other items I saw come up was that it could help aid in digestion. Like, is that just because you're getting everything in your system moving a little bit, or how does that come into play?
That comes into play because there actually is a focused abdominal massage that is done in traditional massage on the mat. And I would say this is one element that's often taken out of all Western type of massage. And so as relieve that central channel, as we're moving the energy up, we come to the area of our lower belly and our navel. In a lot of Eastern philosophies, religions, and healthcare, there is a deep belief, spiritual belief, that the center and the central part of life begins in the central part of the abdomen. And in Western science, we know this is true because we actually know we have nerve endings that we call the anterior plexus that is throughout all of our gut. It is our second brain. And we actually can do a Thai abdominal massage beginning from the navel, spiraling out, doing deep palmar compressions in the way that the colon moves, as the contents of the colon moves. There is a deep emphasis on moving the sideways, and there is a deeper emphasis in moving into the psoas and those deep retroperitoneal muscles that you can only get with a good Thai massage. Of course, that feels really good and it really does aid in digestion over time. And I want to point out this is something that happens good for a long period of time, not just for once. It's not just a relief of one episode, but really a lifetime relief of those type of symptoms when done on a regular basis.
All right, well, we've covered a lot of stuff with the flexibility, various aches and pains, stress and anxiety, digestion. Is there anything else that kind of is on that pro list when it comes to getting a Thai massage?
I would say another thing that's on the pro list is the mindfulness component that actually comes with it, because our minds are so busy and we have racing thoughts, and a lot of those things can trigger and add to the anxiety and the depression that a lot of people do face, and rightfully so. And so being able to use massage in this way is a way to help clients focus a little bit more on their mindfulness, um, allowing the thoughts to slow down.
Well, which none of us do. Yeah. Everybody's always go, go, go
Yes,
in today's world.
right.
Now, who is the ideal candidate for a Thai massage? I mean, you make it sound really good, but is this kind of something for everyone, or are there specific groups of people who might really benefit from this sort of therapy?
I would say people who are overall healthy and in good physical condition and have minimal muscular skeletal problems. Meaning, if you have problems existing with a shoulder or hip joint, this may not be the massage you may want to try out right away because of the emphasis on the stretching, on the emphasis on the range of motion. So if you have that as an underlying condition, you may not want to try it. But if you feel stiff, that you really need to feel like you have to exercise, Thai massage can actually give you that feeling, that it gives you that kickstart when you want to start an exercise program because it can help you feel more flexible. It can increase your range of motion and therefore increase your endurance and sense of well-being if you're starting a new exercise program. If you're in the middle of an exercise program, it'll help maintain the gains that you're having and help prevent any injuries too along the way. I would say it's also good for pregnant women as long as we make adjustments to positioning, depending on which area in life, which trimester that they may be at. And so I would say it's really good for everyone, except maybe for those who are medically fragile and those who've had recent surgery of any kind.
Okay. Now, you had mentioned if you have joint issues, if you had, say, a shoulder issue, could you go in and have it done, but
Mhm.
you make sure you tell the person doing the massage about that, and then maybe they focus on different areas?
Yes, and that's the important part of having a good communication between the therapist and the client, because oftentimes when you're having shoulder pain, let's use that as example, it could be muscular, which we can help with. It could be actually within the joint capsule because this is really all ligaments. So here, sometimes things can get stuck. There can be adhesions, kind of moving that shoulder around can kind of break that up. But if you have very poor range of motion, or if I could feel those bones crinkling in there, then I may not,
I'm familiar with
I
the
may
crinkling
not,
bones, so
yeah, yeah. So, but if I feel that you don't really have a lot of good range of motion plus pain, then I may want to be mindful about what techniques are used on the shoulder. And so it's always good to refer out as well if you continue to have issues, even after several good massage sessions.
Well, what about if you have conditions like you have a heart condition, say, or high blood pressure, diabetes,
Mhm.
cancer? I mean, things like this. Is Thai massage something that you can look at? Can you get benefits out of that might kind of work in adjacent to whatever treatment you're getting?
Yes, you can. And again, this would be for clients who really don't get a chance to have the physical strength or stamina for exercise. And all of these people in these groups struggle with fatigue. They struggle with a sense of poor self-esteem or a decreased sense of well-being. And being able to have Thai massage work within a type three-dimensional pattern, it actually is beneficial for them. It reawakens the body. It reawakens the body's energy patterns. And that all ties back to the sin lines. It is the conceptual belief as we're working these sin lines, we will be addressing all of these other areas too. Not a cure, but we are addressing some of the symptomology from an energetic point of view as well as a physical point of view for our client.
So it sounds like from what you're saying, there's nobody who's necessarily ruled out of Thai massage, but you may have to talk with the person giving you the massage, and they might have to make some accommodations, make some adjustments around whatever condition or health issue you might have.
Yes, that is correct.
All right. Are there any negatives from doing it, or potential negative side effects?
So far in my practice and the practice of my teachers and my colleagues, I will say there are none. And
Okay.
I think it begins to, well, let's go back to good communication between the therapist and the client and making sure that we're reaching the kind of goals that you would like to have. I will say there are some clients that this just not a thing. Maybe it's too vigorous for them. Sometimes some people, as we are aware, they have some issues with trauma and then trauma informed care where they're being touched, but then they're also being manipulated in a way. So there are then those clients that we do try again, once again, try to modify, but there may not be the best type of massage for them.
This is one of those, it seems like everybody likes different things. So you
Right.
just have to decide, or try it and see whether it's for you.
Yes, absolutely.
Right. So if you are interested in trying Thai
Mhm.
massage, how do you go about doing it? Finding somebody who can really give you that sort of professional experience that you're talking about.
Well, thank you for asking. I think professional experience definitely is the key word here. For my certification, I am a registered nurse. I'm a massage therapist, and I have an additional certification as a Thai massage therapist. You do not need any of those professional degrees to actually take the training because you will get all of the necessary training to perform a safe massage as well as the ethics that goes along with it. So you definitely want to look for someone who is certified in Thai massage and at which level that they may be certified. They may be basic, which is great. They may be intermediate and advanced, which is all the better. You would, and the best way to sometimes find those are sometimes yoga studios, because
Okay.
sometimes yoga instructors also are certified in Thai massage. And they bring with them that background from the Ayurvedic side as well. Most studios, again, if you just take a look or if you can Google, you could probably find a very good Thai massage in your area.
Is there a specific certification that somebody should look for?
Yes, there is. There are, because there are different teachers who have different lineages. It is important, at least for me, to share that you ask about what is their lineage, who was their teacher, and who taught their teacher. And so, for example, I know that my teacher was someone that was local here to my area, and that she studied with someone in Virginia who directly came from Thailand. She also went to Thailand to study, get hands on. So she came back not only just with the certification, but with the accreditation to teach and to be able to form at a high level. And so that is kind of where we're looking for people who are passionate about it. You really take step one, which is basic, and then step two, which is intermediate. But every teacher has a different way of offering certification.
Okay. Should folks also clear getting a Thai massage with their regular healthcare provider, their doctor, just to make sure it's not going to maybe interfere with any other treatment or something else going on?
Generally, I will say no, because then we will treat Thai massages the way you would have for a massage, a general massage. Of course, you can always get a doctor's prescription and an order, but it's not necessary, primarily because not all of the therapists, all of the people who are giving it to you is licensed to receive it. I hope that makes sense. Um, I hope that makes sense. You don't necessarily need to have a doctor's order to have it done. If you are medically fragile, you should not have it done. If you've had
Okay.
recent surgery, you should not have it done.
So it sounds like if you're in one of those positions where you have some health issues, you should maybe mention it to your doctor first, and definitely with your Thai massage practitioner, just to make sure everything is good, and that you're a good candidate for it.
And yes, it's always an excellent time to talk to your healthcare provider about all of the things that you're doing to benefit your health. Hopefully, then they get to see the benefit of the Thai massage when you come back for your regular appointments.
Well, I have to tell you, this has been a fabulous introduction to a form of massage therapy that I guess just isn't as well known as others. And I really appreciate you walking us through it, DeBorah. It sounds like Thai massage is just something that might be worth looking into if you're searching for something different, just to kind of boost your health and overall well-being.
Yes, absolutely. Absolutely.
So final thoughts. What would be your last thing somebody should kind of get out of this if they're even thinking about doing it?
I would say use massage as a regular part of your health and your wellness routine. And definitely use Thai massage if you really want to go deeper, if you really want to have your energy levels boosted, if you want to relieve soreness and stiffness in your joints, if you want to feel more flexible and release headaches and other sorts of pain, you want to go a little deeper with the Thai massage. It is like massage on steroids.
Well, that's a perfect way to end. And I'm telling you, everything you just said, it checks a lot of boxes for me. So I think I'm going to need to look into this.
That's good to hear.
So thank you so much for spending some time with us today and really just illuminating a fascinating topic.
Thank you so much, John, for having me today, and I hope you have a good day.
Thai massage is a different experience than your traditional hands-on massage. It's an active form of therapy with stretching and yoga-like poses that can benefit you both physically and mentally. So think about giving the ancient healing method a try and find out why it has been around for more than 2,000 years. If you liked what you heard today, please hit the subscribe button and leave a comment to share your thoughts. Till next time, be well.